In this presentation, a type 4-2A1 fracture of the tibia shaft will be reduced and stabilized using the large external fixator with a multi-pin clamp frame. The objectives of the exercise are to show the clinical indications for the application of the large external fixator, the positioning and correct insertion of the shunt screws, and the construction of the multi-pin clamp frame. The most common indications for the large external fixator include fractures with severe soft tissue damage, either open or closed, including fractures of the tibial diaphysis and intra-articular fractures, damage control surgery in polytrauma patients, and acute and chronic infections in both fractures and non-unions. Needed for this exercise are the compact air drive, the quick coupling, and the drive adapter with quick coupling for 5 mm shunt screws. 4 175 mm long, 5 mm diameter self-drilling shunt screws with a thread length of 60 mm are required. The drill sleeve assembly is also needed. It includes the 6-position drill guide handle, both the long and the short 6.0, 5.0 threaded drill sleeves, the long and the short 5.0, 3.5 drill sleeves, and the long and the short 3.5 trocars. The universal chuck with T-handle may also be used to advance the shunt screws. For the construction of the frame, 2 large MR-safe 6-position multi-pin clamps with 2 MR-safe rod attachments for multi-pin clamps, and 2 11 mm diameter 250 meter long carbon fiber rods are used. To tighten the frame assembly, the socket wrench and the 11 mm combination wrench are needed. Here the socket wrench is used to demonstrate the effect of tightening the different nuts on the multi-pin clamp. The vice plate nuts secure the multi-pin clamp to the shunt screws. The rod attachment nut prevents rotation of the carbon fiber rod. And the rod clamping nut fixes the carbon fiber rod in place. An anteromedial position is recommended for the placement of the external fixator. The shunt screws must be inserted in the safe zones. Here they're shown with the fracture reduced. In general, the shunt screws should be placed medial to the tibial crest. This location is particularly important in the distal tibia to avoid interference with the tendons and the neurovascular bundle. The position of the frame should not interfere with access to the wound for the initial debridement. The fractured tibia is secured in the clamp. The first pair of self-drilling shunt screws are inserted into the proximal aspect of the tibia. The 6-position drill guide is assembled using the outermost positioning holes. The long threaded drill sleeve is inserted into the proximal hole, followed by the drill sleeve and the trocar. The short threaded drill sleeve is introduced into the distal hole. After a stab incision is made, the drill guide assembly is placed through the incision directly onto the anteromedial aspect of the proximal tibia. This position should be outside the injury zone and away from possible paths of incision. The trocar is removed. Since self-drilling, self-tapping shunt screws are used, the drill sleeve is also removed. The first shunt screw is inserted into the adapter, and advanced with the power drive through the drill sleeve and into the bone, until the screw tip is anchored in the far cortex. In the clinical situation, irrigation is recommended while inserting the shunt screws. The tips of the self-drilling shunt screws must be anchored in the far cortex to enable stable fixation. Penetration of the far cortex is not necessary. Once a shunt screw has been inserted, it's released from the adapter, and the drill sleeve assembly is removed. The image intensifier helps to check the final position of the shunt screws. As an alternative, final positioning of the shunt screws may be done manually. So the universal chuck with T-handle is mounted on the first shunt screw, and the shunt screw is advanced by hand until it's anchored in the far cortex. The second shunt screw, distal to the first, is now inserted with the power drive. The 6-position drill guide is relocated. The short threaded drill sleeve is placed in the proximal hole and slid over the first shunt screw. Both of the long drill guides and the trocar are inserted into the distal hole. Once again, the assembly is placed directly on the anteromedial aspect of the proximal tibia. The drill sleeve and trocar are removed. The second shunt screw is inserted through the drill sleeve and advanced with the power drive. The 6-position drill guide is removed. The distance between the two shunt screws can be varied by changing the position of the cannulas within the 6-position drill guide. The second pair of shunt screws are introduced into the distal fragment along the anteromedial aspect in the same manner as the first pair. Care is taken to ensure that they're inserted within the safe zones of the leg. It should be noted that the shunt screws in the distal fragment do not lie in the same plane as the shunt screws in the proximal fragment. Now the first multi-pin clamp is attached to the shunt screws in the proximal fragment. The vice plate tightening nuts are first tightened by hand. The socket wrench is used for further tightening. The second multi-pin clamp is attached and tightened in the same manner as the first. The combination wrench is then used for final tightening of both clamps. The clamps of the proximal and distal fragments are connected together with a carbon fiber rod which is snapped into place. To obtain the required reduction, the fracture is manipulated by using the distal clamp as a handle. The reduction is maintained while the rod clamping nuts are tightened. After removing the plastic cap, a second attachment is connected to each multi-pin clamp. A second carbon fiber rod is inserted into the two rod attachments along the medial aspect of the tibia. The rod clamping nuts are tightened, first by hand. Then comes provisional tightening with the socket wrench, and final tightening using the combination wrench. The multi-pin clamp frame is now complete. This presentation has demonstrated the positioning and correct insertion of the shunt screws and the construction of the multi-pin clamp frame.